All right, I think we're ready to go. Good afternoon, good morning, good evening, depending on when you're reading and viewing this. I'm David French, and I'm the Managing Director with Away Home Canada. And I'm privileged to be in this space and be with you in this space to talk about our learnings from the youth sector. We've had lots of learnings from the youth sector. I'm going to specifically focus on our learnings from the COVID-19 pandemic. And what that's meant for us strategically, what that's meant for community partners practically, and everything else in between. Before we begin, it's important for us to do an land acknowledgement, and given this presentation is being held online, we can't really capture a single land acknowledgement given the richness of our multiple distributions across Canada and internationally. So I will give you a moment to pause and think about your own position with regard to the land in which you find yourself. For those of you that aren't familiar, Away Home Canada is a national coalition focusing on preventing and ending youth homelessness in Canada. Our work doesn't stop there. While our work, for the most part, is focused on Canada, but we have partnerships and chapters in the US, in Europe, and in Australia, and there's a growing movement and alignment around this idea around reimagining these solutions to youth homelessness, elevating the voices of young people with lived experience, finding the intersections between policy, practice, and planning. And we're really eager to dig into this space with you and continue to elevate the voices of those who are doing this work in the community. And as I said before, our work does focus on the intersecting areas that have an impact on not only our community, but systems and the structures in which either create or contribute to youth homelessness, but are ultimately, we feel, are the solutions to youth homelessness. And so policy, planning, and practice. And now you can see, and I'm sure you're familiar with those intersections at the community level. Those intersections at the community level became very apparent within the pandemic, and they became this ultimate challenge in having to circulate and move around these kinds of barriers and overcome them in real time. And so in a lot of our work in this presentation, we'll focus on the idea of real time, because that's how we were functioning and needed to function, not only on our behalf, but on behalf of our community partners. And so if you're familiar with our work, and if you're not familiar with our work, here's a really quick Cole's notes. We believe that preventing young people from experiencing homelessness reduces the likelihood that they will experience chronic homelessness as adults. We know that there's a federal priority around ending chronic homelessness, and we know also that there's a growing acumen and a comfort level with the language and the ideas around prevention, and that moving into a more of a prevention space is a priority and needs to be a priority. And we saw that within the pandemic as well. But we believe that prevention of youth homelessness starts early and upstream. That's with families, with schools. We also believe that there's a level of need around housing stabilization with families or with young people who found housing. The underpinning of our work is the value of families and natural supports, in the idea that they can be seen as the solution to youth homelessness and not always the cause. We also feel that there's a level of intensity around case management, a relentlessness around case management that needs to happen for young people, given their developmental stages, but also the work that's needed in real time for young people. The work that we're focused on really does lend itself towards positive youth development, with a really resiliency focus, but then also something that can really elevate and enhance job skills, life skills, training, those kinds of things. In comes the COVID-19 pandemic, and our work around prevention has a whole new light. And what we feel is a priority pre-pandemic around prevention really becomes this elevated priority around prevention. And so the homelessness sector, the youth homelessness sector, was really hit quite hard, much like others. But we were witnessing and hearing and getting feedback from our community partners that they were having to wind down services quite quickly, shift into new methods of delivering services, but also help shape community level responses around youth homelessness. And they were experiencing some barriers to be welcomed into these larger community responses. And so in engaging with our national learning community, which is a membership community from across Canada, they really felt like we needed to step in and play a role in helping facilitate this ongoing dialogue with our community partners and with those on the ground, seeing the white to the eyes, if they could, the young people who were still requiring services. And so that meant a number of things, facilitating week-to-week peer-to-peer knowledge exchanges, and that came in the form of a community of practice, a real-time COVID-19 community of practice. It meant that we conducted a couple of community-wide or Canada-wide surveys. We helped not only with mobilizing resources like PPE and getting those in the hands of community partners who needed them, kind of moving around some of the systems that needed to happen. As you know, if you remember, it's hard for me to remember, but there was a level of confusion about what does social isolation mean? What does distancing mean? There was clear confusion. We were hearing from young people who were still accessing services about what that means. So that meant curating resources that were not only youth friendly, but then all of that came into this light around peer advocacy for what the youth sector needed. And so, as you can see, we've got an important quote here. It was our role was to curate and to cultivate an opportunity for community to get together in this space and really find solutions with each other. And so the resulting work became not only these two larger survey reports, which again sort of helped underpin not only our advocacy efforts, but also our understanding. In all fairness, Away Home Canada was sitting at the 30,000 foot level, the strategic level, and we were getting now this glimpse into the community level and what they were truly experiencing around the pandemic. And so these two reports are available on the hub or on our website, so I encourage you to access them. But what we were seeing were these top challenges for keeping young people and families housed during the pandemic. And that, of course, social isolation, much like us, was high on the issue scale for service providers, and what young people were expressing were the issues. And so that then resulted, as we know, in a mental health concern and a mental health crisis within a pandemic crisis that I don't think we've seen the actual real results of yet. But as you can see, there was a level of complexity. And if you sort of weave through these numbers, a level of complexity about supporting young people, continue to support young people within this scaled down, whittled down service delivery model that many of our organizations across Canada were experiencing because of staffing shortages, because of restrictions, because of spacing requirements. And this was this real-time shift and change. And what we learned really quickly, and what we've always believed this, that the youth sector is nimble and highly nimble. And the pandemic showed that. And they showed us the examples in which they needed to think and change and evolve really quickly, not only individually as an organization, but as strategic partners with other community partners across their communities. But what we found was that, of course, they were continuing to deliver services to young people, but they were having to do that at a distance or virtually when necessary. But that meant that they were revealing some of the real barriers for young people who were trying to access services either virtually. It meant that young people were being further disengaged and moved underground. It meant that what the role that our community organizations would play in being able to transport young people to services, that warm handoff model that is so familiar within our youth sector, couldn't happen. It meant also that the role that they would play in getting access to daily essentials, food, cleaning supplies, those kinds of things that would happen within our community partners and our organizations couldn't happen either. And so it meant that they were really conflicted and challenged with how do they then provide this service to young people that they could have been providing face-to-face. So it meant that they needed to really think differently about how their service delivery model would look. And we're also hearing that some of those service delivery model changes that happened within the pandemic around right sizing maybe are being maintained because they've seen some real value in what that means for how to deliver outreach services, how to reach into families and natural supports to continue to support young people to remain housed with families. And so what we saw was this sort of these respondents, again, high percentage rates of respondents saying that they were further disengaged from community. Young people who were accessing free Wi-Fi, for example, at a Starbucks or a Tim Hortons or those kinds of things couldn't no longer because of all those shutdowns and the shortages in which they were experiencing there. What we also felt like we were hearing was this overwhelming separation from cultural supports and what that meant for young people and how important that was, not only for organizations who were supporting young people, but how important that was for young people. And again, that further impacted mental health. And because of social isolation, because of the complexity around their mental health concerns, many of our community partners were seeing increased drug use. And that meant that there was an additional concern because of a lack of connection, a lack of seeing the whites of the eyes of those young people around what that meant for their overall wellness. And we heard loud and clear through our real-time COVID-19 community of practice that there was high levels of concern for young people. But what that meant for us as well, and for me, was that there was a high level of concern for our people doing the work, and that they were carrying an additional burden and a responsibility to ensure that they were connected to young people. But what this meant was there is these emerging and new opportunities for a pandemic policy window. And the Child Welfare League of Canada really latched onto this opportunity. And we've often said, we know this, that transitions for young people in and out of systems, particularly young people transitioning out of child welfare, is kind of the superhighway to youth homelessness. And what the Child Welfare League of Canada and ourselves, who were a partner in this National Council of Youth and Care Advocates, did was support not only provinces and territories with placing moratoriums on transitions for young people. And in that period of time, and there's an illustration here if you haven't seen it, of provinces that have moratoriums on transitions and the dates that are associated with that. But in that time, we also collected some thoughts nationally with young people with lived experience, with strategic partners about what are the elements for what new and equitable standards for transition should look like for young people as the pandemic is lifted. And we're getting real traction for that thinking. And again, we see this as a national opportunity to align for provinces and territories to align transition standards for young people when they move into this place around really truly having to transition again. Because we know that the pause is an important pause to harness. And I applaud the Child Welfare League of Canada and the National Council for finding this and seeing this as a policy window to really help shape change in this space. All of this has meant that we have a further foundation for why there needs to be opportunities for prevention to be scaled, for the appetite and understanding around prevention to be increased, but then also these opportunities for us to think differently about what this means for young people and how we respond at the community level, at the provincial and territorial level, and at the federal level. And we took this opportunity, the House of Commons issued a brief opportunity to suggest recommendations. And so because we had the privilege of listening to community partners over this long period of time to understand their concerns, we feel really strongly about really 3 core recommendations moving forward for how the federal government needs to think differently about pandemic realities, but also pandemic recovery. And that meant we needed to advance the interventions around young people experiencing homelessness in a way that needs to be sustainable. So programs that are sustainable, but also focus on prevention, but also focus on sustainable exits for young people. We also knew that within recovery, because of a level of austerity that might be coming from governments and funding, because of the investments that have been needed to be made around the pandemic, organizations were going to need multi-year funding to ensure that there's a level of foundation and stabilization for these sustainable programs to be prioritized at the community level. And lastly, and most importantly, the strength of our pandemic response and our recovery response relies on how strong our people are who are doing the work. And so we needed to provide dedicated funding to organizations to support compassion fatigue, trauma-informed care, and continue learning. We need to keep these people who have kept us in this work and have kept young people safe within the pandemic. We need to keep them and allow them to continue to thrive in this space and ensure that they are properly supported. And we feel that Canada has an opportunity to really come out of the pandemic within the response and recovery to become true international leaders around prevention. And this is an opportunity for us to think differently about what this means for not only for practice, not only for planning, but what it means for policy around this work, and how we then can help shape that work moving forward because of what we learned pre-pandemic around prevention, what were clear and galvanizing learnings within the pandemic around prevention, and what that means moving forward. Thank you for your time. That went by really quickly. Enjoy the rest of the conference.